Alright, so in this video we'll be talking about glucose titration curve and transport maximum. So relationship between plasma concentration of glucose and filtration, reabsorption and excretion can be presented in glucose titration curve. So this is this curve, and we should know that if there is an increase in plasma glucose concentration, there will be increase in filtration. And now let's see the relationship. So this x-axis we have plasma glucose concentration, and on y-axis we have filtered load of glucose. So when we look at this yellow graph, filtered load of glucose increases when there is increase in plasma glucose concentration. So this line is linear all the time. Alright, when we talk about this glucose reabsorbed and plasma glucose concentration, focus on this green line. It increases to a point, then there is slight bend, and then it becomes constant. So glucose absorption increases for some time, and around 250, this 250, what happens is few nephrons are unable to absorb glucose. This means that different nephrons have a different capacity of glucose absorption, right? So few nephrons fail to absorb glucose when the plasma glucose concentration is 250, and hence the glucose start appearing in urine. So this value where few nephrons fail is known as renal threshold for glucose. And then there is a slight bend in the curve of glucose reabsorption. This bend is known as splay, and the splay is formed due to two reasons. The one which I just said is nephron heterogeneity. Different nephrons have a different number of glucose transporters and different capacity to reabsorb glucose. And the second one is low affinity of cells for low affinity of glucose transporters. So there may be few glucose transporters who are unable to hold up glucose enough efficiently to push them into the cell, and that glucose might leak down. So these two reasons are responsible for this bend called as splay. Then there is a value of plasma glucose concentration that is 350, where all the nephrons reach their maximum ability to reabsorb glucose, and hence there is a constant line shows that glucose reabsorption is fixed at this point. So again, at 350 plasma glucose concentration, there is no further absorption of glucose. There is no increase in glucose reabsorption, and the glucose reabsorption becomes constant. So different nephrons attain their Tmax at different levels of glucose. And again, revision for at 250 plasma glucose concentration, few nephrons can excrete glucose, so glucose starts appearing in urine, which is known as renal threshold for glucose. At 350 plasma glucose concentration, all nephrons reach their maximum capability and excrete glucose in urine. So this is known as transport maximum. And there can be 3 crosses for this. Okay, the first one is, alright, before this we can discuss this graph, right? Okay, excretion in urine, glucose excretion in urine, around 250, there is a slight increased excretion of glucose in urine. So there is slight bend, which is also a splay, which has a similar 2 reasons, right? And then after 350, when there is increase in filter load, there is increase in excretion of glucose in urine. Alright, so there can be 3 causes. The first one is we know that filtration load is equal to glucose concentration in plasma into the GFR. So when there is increase in glucose levels in blood, then there is an increase in filter load, and this happened in uncontrolled diabetes mellitus. And in pregnancy, there is increase in GFR, so there is increase in filter load. In that way, glucose might appear in urine. And then if filter load is normal, glucose concentration is normal, GFR is normal, then if glucose concentration is somewhere around upper normal level, then there are a few congenital conditions where there is decreased number of functional, decreased number of glucose transporters, and they could be functionally not so efficient. In that case, there is a reduced renal threshold, and even if less than 250 glucose starts appearing in urine.